The success of acne treatment depends on many factors, many of which are under your control. In this video, I'll discuss some of the most common mistakes people make in treating their acne and how to turn that ship around and correct those mistakes to properly treat your acne. Before we get started, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Now let's get going. So the first mistake, which I see quite a lot of, is using too much medicine. The right amount of acne medication to use on the face would be a pea-size amount for any medication you apply, and even more so for the drying and irritating medications, specifically the retinoid class, whether it's adapalene, tretinoin, or tazarotene, or any other retinoid. These medications must be applied as a pea-size amount over the entire face, meaning a pea-size on your index finger, applied to the middle of the forehead, cheek, and chin, and then spreading it all over the forehead, cheek to nose, and chin, and then do another pass to cover the entire face. That is the correct application. So using too many pea-size amounts, meaning using any more than 1, 2, 3, or 4, or what have you, is too much, and applying it over specific areas, the spot treat, is also too much for that spot. You need to apply it evenly and uniformly over the entire face, and apply the little pea-size amount to mitigate for irritation and sensitivity. People may apply the medications too frequently or too infrequently, meaning people may use a medication that is prescribed to apply once a day, like a retinoid, which needs to be applied once a day at bedtime, or applying it too infrequently, meaning applying the medication once every few days is just not going to get you the traction that you want. So be mindful of the frequency in which you need to apply the medication, how many times a day, and how many days a week, and stick to that schedule to get the most bang for your buck. Using the medication out of time is another mistake people make. Applying a retinoid in the morning, for example, is a mistake, as the medication could get deactivated more quickly than it would at bedtime, and it will exert less of an effect, less of the desired effect on your acne and your face. So you must pay attention to the application schedule, meaning what medications need to be applied in the morning and what medication need to be applied at nighttime, and work accordingly to those prescriptions. Using too much skincare in addition to the prescribed treatment, I can't tell you how many times I've come across people who just wanted to do their thing, add their own little sprinkle on top of the prescribed acne treatment. Now, what's the problem with that? The problem is that many of those skincare products in those skincare routines are abrasive to the skin, and they can make the skin more sensitive. Now, when you have an acne treatment that's already sensitizing your skin, and you're using this redundant or unnecessary skincare product or skincare routine on your face, you're actually risking making the skin too sensitive for you to use the actual medication and get the benefits that you want. So my recommendation, consult with your doctor to find out which products you can actually chuck away, which products can make you more sensitive and less likely to tolerate the medications, and get rid of these products so you can actually use your medications and get the improvement that you need. Not moisturizing enough. So many people operate under the assumption that you can just one and done moisturization or any other skincare step. And the truth of the matter is that you can't. You need to moisturize in accordance to what the skin tells you. Meaning, if your skin is exceptionally dry because of your acne treatment and continues to become dry after you moisturize, then you need to moisturize more and make up for that dryness. If you're not able to catch up, you're not able to keep up with the moisturization for your acne treatment, consider that the acne treatment you're using might be too harsh for your skin, and you may need to readjust the treatment with your dermatologist. Either way, your skin needs to stay well moisturized no matter what condition you're treating or what medication you're using, and you need to play it by ear and use the moisturizer as often as your skin tells you to. Not establishing proper time frames and expectations. So again, this is a very common problem with people just getting into the treatment, not knowing when to expect things to improve. So they lose confidence, they get frustrated, and often they stop the treatment in the middle of the treatment without getting the results that they wanted, wasting time and money on something that is a dud because they stopped too soon. So it's important to set your expectations for improvement, for the stages of improvement of your acne with the medications that you were prescribed. Know exactly what to expect at which time point, and what to do if the expectations are not met. For that reason, you need to set up a follow-up appointment, especially at the beginning of treating your acne, so you two can meet up, can review the results, see if they actually meet your expectations. If you're a happy camper, then God bless, and go ahead with the medication and use it consistently. And if not, you may need to readjust or build a treatment plan from scratch to suit your needs. If you've enjoyed this video, don't forget to smash that subscribe button. Also, don't forget to share and like this video. For more information on how to take great care of your skin and how to set your expectations right for treating many skin conditions, pick up my book, Sick Skin, Skincare Made Simple, on Amazon.com, now available in audio. Thanks for watching. God bless.